I grew up in a family of dentists. Obviously, my inclination was towards dentistry because in our culture, it's so common that we follow in our parents' footsteps. So, यहाँ पे तो you will see very often how kids follow in their parents' profession and in the same, at least in the same field as them. So, my mother was an orthodontist and my father is an oral surgeon, and I watched them working all these years. So, I've been around the clinic. I liked the profession. It seemed very easy to work around. I mean, as a woman with a family life, kids, I saw my mother manage both family life and work. Also, they were struggling. They established themselves from scratch. So it was a little difficult for them, but I felt that if I start to work on this profession, of course I'll be a step ahead because I have already a set up practice and all the guidance from my parents. So that's why I kind of chose this profession. I guess it's kind of obvious, but also as I grew older, I realized that I had pretty good hand skills, and my genetics also are programmed such that I am a little bit OCD, like I'm a little obsessive about doing things right, and I'm able to focus on doing one thing at a time. So for long spans of time, doing one thing with my hands seems to be something I'm good at. I'm good at arts, I'm good at stuff experiments, I'm good at things where I have to spend a lot of time focusing. So I was pretty good at concentrating at things. So I think that's another thing, and my academics also was supporting it. I was good academically, and therefore I thought that it would be easy for me to go into dentistry because I was one of the better kids in the class as far as academics was concerned. I was not a rowdy child, I wasn't a difficult child. I was well behaved, I listened to my parents, I did what they told me, I took sciences from the beginning, I managed sciences. I mean, I didn't excel, I wasn't like a super student, but I was above average, I would say. And under the circumstances, considering both my parents were working all the time, I did fairly well. So, and then we have a very mixed background. You know, my parents are from Peshawar. They grew up there. They moved to Karachi, which is a very competitive, very ruthless, a very cutthroat environment, and they really established themselves here without any family background. We have no family in Karachi, and without any family support, they made it. So looking at them and everything, you know, things kind of easily fell into place. Any background in any field is helpful for any person, whether it be family background or friends or so of course dentistry, it does help a little bit. I won't lie that it's not helpful, but having a background also has its own challenges because you have to follow protocols which are already set and put in place. You have to follow systems that have been established by someone 30 years ago or 20 years ago, and you have to try to mold that system according to yourself. So it is helpful on the one hand, but on the other hand, you have to be able to manage it and mold it according to your own requirements or personality or your education. So yeah, I mean, but the encouragement and the support is unbelievable. To have a family background in the same field, in any field, but in dentistry also, because dentistry itself is a pretty stressful profession, and it has evolved over the years. I mean, it was so many years ago, it wasn't what it is today. So it is moving rapidly. I mean, it's gone from nothing to something, and therefore it is definitely helpful to have some family support. In the 90s, nobody knew about dentistry, or 80s I would say, but then from the 80s to the 2000s, you would see a big change in the way dentistry is viewed upon. So I think it has changed a lot, dentistry, and then having a family person who's been through that change and has seen it evolve is also very helpful for anybody. When I first graduated from dental school, I didn't think I would become an orthodontist. I actually saw my mother working late hours, she would not come home before 7:30 in the evening. I still remember the time because I would wait for her every single day, 7 o'clock, 7:30, and all the kids get off from school, and then she would come at 7. So I thought, orthodontist, no way, I'm going to do, you know, something else. There's 4 or 5 other specialties in dentistry. I can do endodontics, I can do perio. I loved endo in those days when I was doing my house job. I said I can do operative, which is very popular amongst the young kids, and I also thought of all the other specialties. And one thing that changed my mind was 2 to 3 years working as a general dentist. When I went to, the smart thing that I did with my life, I didn't realize at the time that it was a good thing I was doing. I thought it was just an additional qualification, but I went and did again 2 years of general dentistry in the US. I got a DMD degree, which is up there. So I got a degree from Boston University after my BDS. So I got another general dentistry degree. That gave me another perspective on general dentistry. And then I worked for 2 to 3 years as a general dentist. That helped change my whole view on dentistry, and that gave me a lot of information on what kind of specialty I want to go into. That's why I would advise any dentist to wait for a couple of years, or maybe at least a year, before deciding what specialty to go in, because you can make the wrong decision very quickly. And I saw myself change over 2 or 3 years and completely went from a different way of looking at dentistry to another way. So I think I would recommend definitely waiting at least a couple of years. And then I chose orthodontics as my specialty, and then I went back to school for 3 years and did orthodontics. And then that has really helped me a lot. I mean, ortho is probably 50% of what I'm doing, more than 50%. And it's what I'm really proud of, and it's what helps me sleep at night. Let's put it that. I mean, it's what I look forward to. It's what makes me smile every day. Orthodontics is something else for me. I can't explain it to you. And therefore, I would recommend definitely specializing. I didn't think I would do specialization. Okay. I didn't think I would specialize. I thought I would do general dentistry. I did 2 years at Boston University. I was happy. I said, let's just do general dentistry for the rest of my life. What changed me was when I went to Saudi Arabia, and I worked there for 2 or 3 years, and I saw a huge amount of specialists. I saw the good working hours. I saw the respect. I saw the lifestyle of the specialists. And then I thought, wow, that's really something else, and that's what really motivated me. So then I worked with a pedodontist, I worked with an endodontist, I worked with a prosthodontist. I didn't like any of them. The only person that was left behind was the orthodontist. So I said, these 3 are definitely not my cup of soup. I was very close to doing pedo. But I changed my mind on pedo completely. I said, no, that's not going to work. And then I did orthodontics, because that was the only one I could see myself doing. And then I ended up doing it. But did I think that I was going to end up doing orthodontics? No way. Or specialize and study as much as I did. But that's also the support system. My husband helped back me, and a lot of stuff had family support to do it. But I thought general dentistry was enough. I mean, okay, how important is post-graduation? Well, it's kind of sad, but I have to say that people are moving towards not liking post-graduation. A lot of people prefer doing just general dentistry because of the expense, number one, and I think that's very important. I mean, I understand. And then the families, you know, people want to get married, have kids. Nobody has that much time to do it. So these are the bad points of doing post-graduation. But how important as a person, I mean, it's the biggest gift you can give yourself. I mean, if you can give up anything in your life, it will be this. I mean, I would recommend to any dentist, if you want to favor yourself and you want to give yourself the professional satisfaction and make yourself feel proud of your own work, I would definitely suggest doing some type of post-graduation. So yeah, I mean, it's a personal thing, but of course people have so much family pressures and other issues, you know, financial issues, where they can't get out of it and they can't do post-graduation. But even if you're 60 years old or 50 years old and you have an opportunity to do post-graduation, I would recommend going for it. It's better working hours, better pay, better lifestyle, more respect, and you change as a person. I mean, you look at things differently. So it does pay you off at the end of it. So if you are ready to make that investment and you believe in yourself, go ahead with it. But you have to be confident enough to say, I can do this. That's something that comes with time, and if you're ready, then do it. But don't put yourself into it just because everybody else is doing it or because it's just something that looks good. I think you should do it because you know that you can do it. And you know it's going to improve, and you're going to take that and make something out of it. You're going to take that education and do something with it. If you're not going to do anything with it, don't bother doing post-graduation. But whichever country you are, wherever you are, whether you're in Pakistan or you're abroad, you should just try to make sure you're going to make something of it, and you're going to continue to work on that in that field. Okay, my experience at University of Pennsylvania was probably the best experience that I've had. They also kept me as faculty for 1 year after I graduated. It felt like family. So, I mean, there's nothing negative I can say about my experience there. In orthodontics, I never felt, all my life, with all the education that I've had, I never felt so apart of a group or of a program as much as I was in University of Pennsylvania. For the first time, I made the best friends I've ever had. The faculty was the best I've ever seen, and they've made me feel like a family. Like I actually felt part of a unit. I still feel part of them. I want to go back every day. Like there's not a day where I don't miss it. So maybe I was lucky. My experience was great. I don't know, but I've had an amazing experience. And I've heard some bad experiences from other people, but I don't understand how it was for them, because for me it was unbelievable. 3 years with 8 residents, I was day and night with them, and they took care of me personally and professionally. They were there by my side with every patient, with every case. They helped me, literally held my hand and like put stuff for me. So, and it's a full-time program, so it was 5 days a week. And even on the weekends we would go in on Sundays, and I never felt like it was work. It was always like fun to do. But everywhere I am, I feel the presence of the same thing. So I didn't really look into post-graduation at that point. I just did general dentistry and then I left. So I did general dentistry in the US because I actually wasn't even satisfied with my general dentistry education. I'll be very honest with you. I didn't feel like we had the equipment or the material at that time. I felt like I could do better. So yeah, so the basics were a little. Then I looked into post-graduation only when I came back from University of Pennsylvania, just to see what kind of, I want to teach. So I looked into some programs. The gold standard is CPSP, FCPS, that's what everybody is going for. But what's really sad is the pass rate. For me, this is what really put me off, and I wanted to become a supervisor, but and they say you should go and change the system, but 4% was what I was told by one of my students. Now I don't know if this is correct, you can check, but he told me in orthodontics, which is my field, 4% was the passing grade. So I said, okay, that means 96% of people fail on first attempt. Probably on second or third attempt they do well, but I don't think that a program in which the first attempt 4% people pass, 4% people pass, 96% people fail. So if 4% people pass is very depressing for me, even as a teacher. If I know that this student, there's a 4% chance he's going to pass, it's a bit tragic. I think that any program in the world should have at least a certain number of pass percentage, or don't enroll them. I mean, if you are not qualified to pass a program, if only 4% of people are passing, then there's something wrong with the enrolling process, or there's something wrong with our basic general dentistry system, or with the house job, or something is not right, because no program in this world should be a 4%. That's very depressing. That's like discouraging the entire population from doing. If you want to discourage someone, you tell them you have a 4% passing rate in this exam. So I mean, that kind of answers your question. I was very depressed initially. Dr. Umar Ansari will give you the numbers. He's actually also appearing second or third time in FCPS part 2. But he spent like at least 6 years or something like that. So it's a bit sad, that part really bothers me. So I kind of got put off, so I didn't really, I can't be impressed, or of course I'll try to work, I will try to become a supervisor. I've contacted them about doing courses and becoming, but the supervising board or whoever is there should do something about this this problem, because I think that we need to work as a group to encourage people to do post-graduation, not discourage them, because what's happening now as a result is that general dentists are doing everything on their own without any training, and there's no motivation. Why will someone want to go and get into a program which is giving them a 4% pass rate? Why will they rather sit in their clinic and try to do something on their own in the wrong way? But it's okay, they'll do it a few times, maybe they'll get better at it, but they'll do a mediocre level job, but rather do that than waste your time going to post-graduation. So it's really tragic that we don't have that system. And also we then, as a result, we don't have enough faculty. There's not a lot of people my age with my qualification, unfortunately. I feel there's, like, if you go on the American Board of Orthodontics website, and from India you have like 3 or 4 people who've done American board certified. I'm the only one from Pakistan on the website. My generation people are not doing it, and they're not interested, and it's in fact they might think I'm crazy because I'm probably the only one, so they look at me in a weird way, like, what's wrong with her? Why would you spend so much money on your education when it's not even paying you back? And because they have lowered their standards, their charges, their everything to because they couldn't go, so patients are getting, and patients are also lowering their standards, so the entire population is lowering their standards instead of improving it and bringing it up. So this is a very, this problem can, if you encourage people to do post-graduation and increase the pass percentage or choose your students carefully, then people will be more motivated to go into such a program. There is a hope for MDS and MS programs, but that is also right now, because PMDC is changing, and we have also started an MDS program since last year, but again we are affiliated with Uddin University and we are still working on the affiliation and all of that. So that is something which will bring hope to post-graduation, because MDS and MS are degrees awarded by institutions, but they're so young. I mean, it's going to take a long time, another 20 years for us to. The only gold standard that we have is FCPS. I think, is there MCPS or MDS? We started MDS, yeah, but what SCPSP is only FCPS, only FCPS right now. So they are the gold standard right now, and I think they're the only ones who can help us. I mean, other than them, the MDS will take time to evolve and improve, at least another 10 years to become a good.
Because that's still on its way.
Yeah, so it will take another maybe 5 years, 6 years. I mean, I don't know how long it's going to take, but we have to produce those students and then see what happens. But we need to make this more easy so people end up doing it. And that's our responsibility, not the responsibility of the students to try to pass the exam, which is 4%. It's our responsibility to try and encourage them, do more marketing for postgraduate programs, reach out to them. But then the PMDC should approve and allow more postgraduate programs like MDS, MS, and become more active in that. Instead of increasing the students for BDS, you should try to give us more MDS and MS, because we need more. We don't need a lot of BDS people now. We need more MDS, MS people. So you've got a lot of general dentists and you haven't got enough specialists. So what's going to happen? The general dentist will be doing the specialist job not so good, you know. So it's like, you need to increase that. I mean, okay, so first of all, let me start from the basics. The faculty, we don't have enough faculty. Again, it starts from there. When you don't have enough of something, now in the US, I had 35 part-time faculty members for 8 residents. 35, University of Pennsylvania had part-time faculty members for 8 residents. How much faculty is that? What's the ratio? It's a huge ratio, right? Here, we can't find qualified people. Over there you have too many qualified people for a small program of 8 residents. And here there's not enough people. I mean, and then what happens as a result is that they dictate their terms, they dictate their timings, their salaries, their hours, because we have to listen to them. We are like we are bending down like, please come, sir. It's like the respect is at another level. Whereas over there, it's the opposite in the US. The US, it's the opposite. The faculty is begging to come to teach. They'll do it for free. 35 faculty members come for free to teach. They come for free because they enjoy teaching. They love it. It gives them, it gives their profile, it makes their profile look good. They advertise it, they market it. We are teachers, we teach, There's a completely different way of looking at it. And they'll spend their own gas, their own petrol, their own parking. Not even their parking fees is paid for. They pay for their own parking. They'll take the residents out for lunch and all free, Okay, and what are they getting out of it? Nothing, not really. I mean, okay, they market it on their website and they show that they're faculty. Maybe they get a few CE credit hours and they get free courses and this and that. But the time that they put in and their sincerity is another level. So when you have a lot of people in a lot of specialists, that creates competition. When that creates competition, that creates quality. And that's what Karachi is proud of, because we have a lot of competition, we have a lot of quality, because we give a chance to everyone and everyone has a chance to come up. So if it's going to happen, it's going to happen in Karachi. If it can't happen in the other cities, they're too small, because we have a lot of people. And increasing the number of postgraduates will improve the quality, because they will compete with each other eventually. But that's going to take a long time for us to get to that stage. So that's the question you were asking, the difference in the education standards. So then that improves automatically the same course objectives we have as they have. But the implementation is different because of the number of faculty and the number of educated, qualified people, and the number of people that PMDC is allowing to get through. I mean, my own certification has been there for 2014, 2 years. PMDC is going to call me for an interview in the next few months. I mean, another colleague of mine, she waited 3 years. So, I mean, if you're going to wait 3 years to give somebody an assistant professor status, what are you going to expect is going to happen in the future? I mean, the system needs to, it's all about the authorities at the end of the day. It has to happen there. They promote MDS, they promote MS, they promote more postgraduates, they approve more assistant professors, they approve more associate professors, they give us more professors, we're in good shape. But of course, they have to choose between deserving and non-deserving candidates. But that's their job. But they are also under a lot of pressure. They have so many problems going on, so that affects us, eventually. I mean, we say it doesn't affect us, but cycle. It's eventually after over 10 years we'll see there'll be less people, because there's not so many people of my age right now who are coming back and doing post-graduation, and so this in 10 years there'll be again a drop, because the older people will be disqualified when they're above 60 something who are running right now, and there's not enough, we're not taking out enough postgraduates. And then we have a brain drain problem also, that a lot of people who do FCPS and all of this, okay, if he's really good, he will possibly leave the country. So they can, because FCPS is approved in a lot of countries, so a lot of people do prefer to go away because of security issues or like the sectarian problems or something. I've had a lot of people move out of Pakistan with set practices. I mean, the parents are here, but the kids are gone because they don't. So my generation is actually getting out, which is sad for dentistry. That means, again, who's left behind is the basic general dentists who don't have much training, don't have much background, and are trying everything they want. So again, that's another issue. Well, initially I like Sensodyne as a toothpaste. It's a good toothpaste. I've had a lot of patients who've given me great reviews, and it helped me a lot, because diagnosis is a very difficult part of our profession, and to find the right treatment for every patient is very difficult. Sensodyne has answered a lot of my problems, has solved a lot of my problems when I've really had difficulty doing anything. So yeah, Sensodyne is like the best. It's the gold standard. It's the oldest toothpaste. It's well known. It's been around for years. It's probably had the oldest technology, and they are the most rapidly changing systems. They've got a lot of variety. So I'm a big fan of Sensodyne myself. Second thing is, how has it been for me? in the Sensodyne, as being an ambassador for Sensodyne. Okay, so it's been, actually the team has been excellent. I'm interested in marketing myself. If I wasn't doing dentistry, I'd probably be in marketing. So it's something that's interesting for me, and I like to learn. So after doing my post-graduation in orthodontics, I'm interested in website designs. I'm interested in advertisements. I like to learn about how people sell things. I'm interested in customer service. These are things that interest me besides dentistry. I mean, this is something I'm kind of, my training was such. When I was trained in UPenn, they didn't teach us just dentistry. They taught us how to run a practice. They taught us how to market, how to sell, how to advertise. My guru, the guy who I worked with in the US, I worked for him for a year. He has like these amazing TV commercials that he sends out. He's got his website is unbelievable. His stuff, internal marketing is just amazing. And it excites me, this thing. I mean, marketing is something that so that's why I got into this, because I wanted to learn from them, because I like the way they do stuff, and I wanted to see how they do. And I keep asking them, like, does it make a difference if I'm doing the ad, and how do you guys count your success, and how do you guys approve it? So that's why I got in. It's just pure like interest. Because I thought maybe if I get into it, I'll get an idea, and I see what they're looking at, because they pay attention to the little details, like the clothes and things which we as dentists don't think about. So we are always taught to do good treatment, but we're never taught to present ourselves well, or to talk like this, talk slowly, don't say this, and speak like this, or keep your eyes straight and look at me, make eye contact, or stuff like that. So there's things that they teach you on confidence. It increases your confidence also. So they taught me a lot of things. So that's why I did it. It was interesting. And then of course my family has been pushed by Sensodyne for at least 10-15 years to do an ad, and my parents have refused, both of them, because they're old school and they're like, ye nahi chalta, My dad is still thinking of like newspaper, He's like, nahi.
So you might be happy from our newspaper.
Daddy's like, nahi, the newspaper. I'm like, nobody reads the newspaper. I mean, you read the paper on the computer, but nobody actually physically opens the paper. I'm like, now everything is electronic. We go on Facebook. There's links, and because paper is like a waste of money now. So but that generation is now. So I think the best way of communication is through videos, and Pakistan needs it. I mean, if there's somebody who can come up, not in my field, even in any field, if you have any good background, I want good people to come up, because we have enough negative things going on. So why not positive people come on TV, show yourself, so that people know there's more than just other things going. Plus there was a lot of toothpaste that I saw that I'd never heard about being advertised on TV, and I don't know what's in it. So there's a few names, I don't know which ones, but I'm like, what exactly, and my patients are asking me about it. What about this one and that one? And I'm like, I don't really know about this toothpaste. So I'm like trying to promote Sensodyne, and people are coming with all these other weird names where don't know what's in it. So I try to promote. That's why I got into this. And I think my parents should have done it. I've been pushing them, they're not doing it. I'm telling my younger brother to do it next year. Hopefully I'm done by December, then January he can do it. But we need to promote good stuff, and I'm ready to promote any good. So not just Sensodyne is not the only thing. I mean, there's so much other stuff in the market that's very good. I mean, I'm a big fan of other materials which I could promote once I'm done with this 1 year. I think they don't allow you to do any competitors for a year or something. They have some contract, but I have to take permission from them for that. But I would promote any good stuff. So I just stick to them. And but people have to go out and make friends or make a team. There's a lot of people do that now, because that's the only way to go. You can't really sit alone as an orthodontic office and just be like, I'm just going to do orthodontics and nothing else. You have to end up doing some general dentistry, or offer some general dentistry in your office, so that the patient stays inside your office, because that's what's happening now. This is the trend. Everybody's moving towards not referring. They don't refer anymore because there's not enough patients, and especially in Karachi, where the population is growing very fast, and people don't have that much money, and the middle class is growing. So I think that the charges are becoming too much. I mean, I have people complaining about the charges every day, and there's so much competition. They shop around. Like they'll go from one, they'll tell me in that office this much, this office this much, this. They're like full doing homework and coming with sheets of like different prices. They probably take my prices there and then compare. So it is difficult, but we have to work on marketing, we have to work on education. I mean, I'm not just practicing this, I'm teaching and I'm doing marketing, I'm running the MDS, MS program for us. So I'm doing a lot of other things, and of course we have our own discussions amongst ourselves, but I've also cooled down in my ambition. I was very ambitious about 2 years ago, extremely. When I came back, I was working like a dog. I used to work till 9 o'clock at night. I was obsessed with working. But now after 2 years, I've just said like 7 o'clock, I need to go home. Like this is crazy. And my husband's also surprised. Like, yeah, you used to come at 9, 9:30 and now you come at 7. But I've like taken it down because I believe that in Pakistan, you need to be a little bit more calm about, you can't like in the US, I was working a lot more. I was working 35 patients a day, sometimes 50, sometimes 60 patients a day. And the life was very like, we couldn't sit, you know, I couldn't sit. Here, it's like very, patient takes an appointment at 10 o'clock, he comes at 10:30, 11. Sometimes his morning appointment comes in the evening. So we have to be very flexible and very relaxed and low-key and not like expect people to be on time. Yahan pe the lifestyle is very relaxed and very slow. I think it's probably faster than the rest of Pakistan, but still there's a little bit of, for me, comparing to the US, if the patient comes 15 minutes late, we have refused, go please. You have to go home, make another appointment. Like that was how bad it was. Here it's like you come in the evening, you go, like they have no time. And I think even the culture of appointments is not even there. It's like you walk in like it's a shop, you know, you go in and then yeah, it's a shop. So that's another problem I'm having. But yeah, I mean, I'm enjoying my mother did orthodontics for 30 years. I took over her patients. She sat with me, she gave me all the models and the cases and she said, this is yours and now here, this is one case, 2 cases. She sat and she explained it to me and she never asked me what I do with my cases and she never challenges me. I'm like, you know, like maybe we can have a discussion, and she's like, no, I trust you, you can do it. So she's given me all her patients and she doesn't want to do clinical dentistry. She works in the academic side. So she's given up this, but she's like, you enjoy it now, just do it. And she doesn't interfere in any of my things. My dad comes and he like tries to find out what's going on, but he doesn't know much about ortho. But I'm the one, my mother was doing it, then I'm doing it. So she doesn't interfere, she's a good boss. I mean, she gave me everything. And I mean, she's very helpful. So I had a good guide and she built up a practice here over the years. So now I'm just taking it forward. Okay?
So 2 more questions. Okay. Do you think you'll be still interested in dentistry in the next 10 to 20 years? After
Yeah, but I'm moving more in the business direction. I'll be honest with you.
I got your point. Yeah,
I'm actually now going to enroll in some business courses and I've already planned that out. Because you see, we are human beings. You know, I want to learn. How can you sit and do just one thing and not do anything else? I want to learn about every aspect. I want to learn about the reception. I want to learn about the accounting. I also want to do accounting courses at some point. I want to learn about this sterilization equipment. I want to learn about equipment engineering. I mean, there's so many things. There's not one thing that I'm not going to learn. My brother knows how to set up a dental unit, like with pieces. I don't. You know, I was feeling bad. Like I don't understand. Like if this breaks, how do I screw it back on? So I'm interested in that. I'm interested in IT courses. I'm interested in bringing software. So yes, I will be interested, but something related to dentistry. But yes, I will definitely do dentistry. But dentistry for me now is a hobby, like I said. You know, it's not like I'm learning like crazy amounts of stuff. I'm learning every day, but not that level. But I want to like learn marketing and IT, business management, and development.
Okay.
Yeah.
So what are your views about dental news and any message for the upcoming
Okay, dental news, the quality is very good. I enjoy their papers. I hope more people come forward and give interviews for dental news, because I think for the younger graduates who are coming up, I think it's a great source of information. And that's why I teach, is because I want people to know that I exist and that there are people like me out there. And I want other people who have similar qualifications to come forward and be like, hey, I'm here, I'm in Pakistan, I'm working, I'm doing this. And dental news is one of the, probably the best for dentistry. I mean, probably all our graduates, all our undergraduate students read your paper. Yeah. And we read it also, but because we're so busy, sometimes I miss a few articles here or there, but for them, it's like a really good source of information.